All right. Thank you so much for joining us for this month's meeting of our AI working group. In terms of topics to cover for today, I wanted to talk a little bit about some of the AI provisions in the Consolidated Appropriations Act that was signed into law earlier this month. And then a new report from the Senate Health, Education, Labor, and Pensions Committee chairman about his vision for the future of the FDA. And then I wanted to give a recap of an HHS conference I attended last week, as well as one coming up next week that's open to the public. And then, as always, any other items that we didn't cover that we wanted to talk about and upcoming events. And of course, if you have any questions, feel free to jump in or raise your hand or put them in the chat. So, as you may have known, earlier this month, there was a brief partial shutdown of the government when funding for a handful of agencies lapsed on January 30th. Um, Within a week, a new bill was signed into law that was made out of a compromise between the White House, Senate Democrats, and Senate Republicans to separate the Department of Homeland Security funding from the other agencies in the bill, which included things like DoD, HHS, Labor, Transportation, and others. And so this new bill, which stripped out DHS, was signed into law. The big story from the bill was we got a longer extension of the telehealth reimbursement flexibilities for Medicare through the end of 2027, as well as an extension of the acute hospital care at home program through September of 2030. Interestingly, in the over 1,000 pages of the bill, the phrase artificial intelligence or AI is only mentioned once.
Hmm.
And this is in a new directive to the Comptroller General to conduct a technology assessment of and submit to Congress a report on the capabilities and limitations of wearable medical devices used to support clinical decision making. And such report shall include a description of the potential for such devices to accurately prescribe treatments, an examination of the benefits and challenges of artificial intelligence to augment such capabilities, and policy options to enhance the benefits and mitigate potential challenges of developing or using such devices. And so this report is due to Congress by August of 2027. This, of course, comes after HHS, as well as members of Congress, have signaled an interest in promoting wearable medical devices. This also comes as last month, the FDA signaled that it would relax a lot of its oversight of AI and medical wearable devices. And so this is likely a continuation of this policy objective of both members of Congress as well as the administration. Any questions or comments on this?
Lydia, Joe, this may not be a fair question for you. If so, just say so. But would you know where I could get a good analysis of the best literature on the efficacy and cost effectiveness of wearables um, with or without a clinical decision support capability engrafted onto them?
Yeah, I don't think we have any like studies or literature reviews on hand. Micah's saying open evidence AI. Um,
Thanks, Micah.
It's also tough because a lot of these wearable medical devices fall in the like general wellness category, um,
Hmm.
which kind of makes them a little less regulated and less formally defined. And it's a pretty broad category. Um,
Yeah, it could take you out of the medical device category altogether.
right. And so I don't expect that this would be the last that we'll hear about wearables between now and August 2027. Um, but this is another indication of Congress and the administration's continued interest in this area. Speaking of the FDA, Senate Help Committee Chair Bill Cassidy just put out a report, and I'll put the link in the chat if you're interested in taking a look at it for yourself. Um, just put out a report on his vision for the FDA. This comes as earlier this week, a handful of HHS leadership announced their departure from their positions, including the HHS General Counsel, as well as Deputy Secretary Jim O'Neill. Um, RFK is still at the head of HHS and is expected to stay at the head. Um, but included in Cassidy's report on his vision for the future of FDA is a pretty substantial discussion of specifically the FDA's role in regulating AI devices, AI software, or devices that are in any way involved with that. Um, and so some quotes that I pulled from the report include that the FDA should focus on areas where AI outputs directly inform regulatory submissions and benefit risk assessments, and where existing processes do not already guard against critical risks. He also calls for, within its statutory authorities, FDA must provide clarity about how it scrutinizes particular uses of AI and the specific organizational elements at FDA that will be involved. It also calls for the FDA to work with other agencies within HHS, as well as government-wide, to ensure that standards and frameworks do not conflict, specifically on clinical decision support tools. It is saying that requiring FDA review of clinical decision support tools will likely stifle and slow advancements in digital health. And then finally, as digital health technology advances and an increasing number of updates come before FDA for review, FDA's backlog may worsen, potentially overwhelming the agency, and that Congress should consider ways to change or supplement the existing medical device review pathways to properly evaluate software so that new products have an efficient and appropriate pathway to market. And so, kind of in line with a lot of the other desires from both members of Congress and the administration, the priority is, of course, trying to get as many devices through the regulatory process as possible. Um, and in this instance, specifically to promote the use of AI in healthcare tools. This also comes as a handful of Senate Republicans have been rather critical of HHS's approach to a number of issues. Um, and so how the FDA or HHS more broadly might take this report. This was just recently put out, and so whether or not there will be any sort of formal response or perhaps a hearing on the matter, we'll monitor for that as well. Any questions or comments on this one here? I also wanted to talk a little bit about some public meetings that HHS has been holding. These have kind of been billed as opportunities for the administration and specifically HHS to promote some of their work over the past year, as well as signal what their focuses will be for the coming 3 years. Specifically, on the top was the Assistant Secretary for Technology Policy's annual meeting, which was last week, as well as CMS's Burden Reduction Conference, which is next week. And so at the ASTP meeting, a lot of the focus was on the administration's efforts in advancing interoperability, as well as its overall health tech ecosystem initiative that it started last year. Some of the panels I attended was there were a handful on information blocking and the administration's interest in increasing its enforcement of its information blocking regulations in the interest of promoting data sharing, as well as I attended a panel on TEFCA, and which also came as the administration put out new numbers on a pretty substantial increase in TEFCA utilization over the past year, as well as a continuation of a lot of the same themes of promoting transparency, patient agency, interoperability, and promoting the use of AI in these tools. This meeting also came as a handful of regulatory documents from the agency have comment periods, comment deadlines coming up, including the request for information on AI policy, the HTI 5 proposed rule, which updates a handful of certification criteria, information blocking regulations, as well as defines the role of AI specifically in that. And a recent RFI that was putting out on AI in diagnostic imaging. And then next week, CMS is holding its Burden Reduction Conference here in DC, as well as virtually. It's a bit of a shorter one. It's only about 4 hours on a single day. But one of the panels will be specifically on using AI tools to empower clinicians and patients, which will seek to discuss how AI tools can streamline workflows, improve care delivery while maintaining trust, safety, and accountability. And CMS Administrator Oz will be also in attendance at this meeting and will be speaking. And so this will likely be another opportunity for the administration to highlight its efforts specifically in burden reduction and what role it sees for technology playing in that as well. And this one is also open to the public. And if you're interested in listening in, I can put a link to that in the chat as well. Registration is free. Any questions or comments here? Those were some of the main things that I wanted to highlight for us for this meeting. Is there any other questions or topics that we didn't cover that you'd like to talk about? One thing I'll also note is that there was a, congressional hearing that was just announced for next week. Um, I'll have to double check the committee, but it's specifically on the future of the healthcare workforce. And so I imagine that AI and the role that it plays in either supporting, supplanting, or augmenting
Yeah,
in either supporting, supplanting, augmenting, or none of those things for the healthcare workforce will likely be a major topic during that hearing. Any other questions or comments?
Lydia, are you hearing much with respect to the executive order and such on AI and states regulating AI with respect to that DOJ task force or anything else?
Yeah, I haven't seen any updates from that since um, the executive order was issued back in December.
Hmm.
Um, Nothing in terms of like the announcement of who would be on that task force or any initial targets,
Yeah.
um, nor when it comes to the potential restriction of BEAD funding. Um, Actually, I believe recently, Commerce Secretary Letnick recently testified before Congress and talked a little bit how it's almost through all of its state applications for BEAD funding.
Okay.
So whether or not this new executive order um, affects that remains to be seen.
Yeah, I mean we're working. We just hit the halfway point in our legislative session, and there's at least 5 bills related to AI in Washington State. That I mean, they're not strictly touching the technology itself. It's just how it can be used. So things like it cannot be used for prior auth denials or utilization review revocations. And then there's a couple on AI chatbots that deal with identity verification, especially among the youth and that sort of thing. So I wasn't sure if that would cross the line. I think if you looked hard enough, it probably would with the executive order, setting aside the fact that there's no federal law for it to enforce. So it's basically supposed to be meaningless, but that doesn't seem to have stopped this administration.
Yeah, it's the wording of the executive order itself is pretty broad and vague. So I imagine that would give Attorney General Bondi and others in the DOJ pretty broad discretion to pursue how they see fit. And specifically, it wants to pursue litigation on the grounds that it is unconstitutional and violating interstate commerce clauses of the Constitution. Um, and so that seems to be the grounds that they would be pursuing these litigation.
Well, be interesting to watch.
Hmm. And we'll make sure once we get updates on how the administration is moving forward here, we'll make sure to keep you all updated as well.
All right, cool. Thank you.
Any other questions or comments or topics?
The meetings that you attended, Lydia, was there continued support for TEFCA? And did they mention how many comments they've already received based on the updated certification rules?
Yeah, the administration has at least so far signaled that it is continuing its interest in TEFCA. I can find there was um, a press release that was put out, I believe, last week, um, demonstrating the administration's like success with TEFCA. Yeah, it reaches nearly 500 million records exchange as HHS leverages technology and AI to lower costs and reduce burden. And so this is kind of how the administration is signaling its perspective towards TEFCA. Um, and
Okay,
so
good.
there was also, during the meeting, there were listening sessions held both on the AI RFI as well as the HTI-5 rule. Um, and there is a couple of sessions that were specifically on TEFCA, which was one of the ones that I attended, um, kind of talking about the administration's goals, and how they're in like phase 2 of 4, of kind of integrating FHIR and TEFCA and putting those pieces together.
Great. Thank you for that. Thanks for the link too.
Mhm. So yeah, still seems to be pretty positive, which was also communicated in the HTI-5 proposed rule as well.
Yeah, they communicated it, but I think at least in my HIMSS forums, there was some skepticism about whether or not they were going to continue to stay in support of TEFCA, or if this was kind of eroding some of the TEFCA standards and work, but which I think may have created this need for a press release that you put the link in there for. So anyway, I think it sounds like they are continuing to support it, which is good.
Yeah, especially since, like for example, it's saying that HHS laid the foundation for TEFCA under Trump's first term. Um, and so they're
Yeah,
kind of promoting it
exactly.
as like this is the Trump thing and it's good because of that.
Right,
Um,
exactly.
so if there are no other topics or questions or comments, um, our next event coming up is our the first in a series of monthly roundtables that we are hosting. This one is virtual, and we'll continue our discussion on the role of digital health in addressing the clinical workforce shortage. Thank you all so much for joining us for this month's meeting of our AI working group.
A quick
Uh,
question, Lydia.
mhm.
This is Dave Alburn. The IMLC and I and other groups are doing a lot of work in the for the international medical graduates as a solution to that. I hope that that'll be a major topic in this next upcoming group discussion. Okay.
Yeah, I'll put the link in the chat. But kind of the three main topics that we talked a little bit about during the uh, summit in December has to do with pipeline, retention, and burden. Um, and so those will kind of be the three main themes that we'll be centering this conversation around. So I think that would
Okay.
fit in pretty well.
Thank you.
And with that, that's all that we have for this month. Thank you so much for joining. Our remote monitoring working group is next week on Monday. I hope you all have a great rest of your day.
Take care. Thanks, Lydia.
Thanks, Lydia.